So, have you ever gone to a doctor with specific symptoms and left with medication that didn't help? Or maybe you were rudely addressed or completely dismissed by a healthcare worker. It's easy to feel that you are just another number or that you don't matter. But what if there was more to the story? What if the healthcare worker didn't have adequate sleep in weeks because they are short-staffed? Without enough sleep, we all know that nothing good comes of it. Not only may this person be physically tired, they may be mentally and emotionally drained. Healthcare workers, burnout affects everyone, whether you are the patient or the worker. The Agency for Healthcare Research and Quality defined burnout as a long-term stress reaction marked by emotional exhaustion, depersonalization, and a lack of sense of personal accomplishment. I will thoroughly cover why healthcare worker burnout is so common. I'll discuss what healthcare workers can do. I'll give you practical tips the public to make change. And as the need of healthcare increases, the burden of healthcare increases will too. And so let's take a deeper look into defining burnout and resolving it, or at least attempting to. Healthcare worker burnout is a chronic syndrome as a direct result of workplace stress. It can be disguised as dismissiveness and contribute to depression. Burnout among healthcare professionals is misleading. Burnout cannot be captured in a capsule and only released while at work. It affects home life, relationships, and health. There are many causes, but not limited to consistently working long shifts, limited life balance, and poor job management. According to the National Academy of Medicine, more than 50% of doctors report experiencing burnout to some extent. Healthcare workers are the forefront of patient care. This pressure to give adequate care to everyone comes at a cost. As a result of burnout, patients are deeply affected. Patients become more susceptible to receiving erroneous information from healthcare providers. Their information can be mixed up between them and other patients. And some events, this mix up can be the difference between life and death if the wrong medication is prescribed. Also, providers are more likely to miss critical health symptoms or diagnosis. Patients can also sense when the healthcare provider is burnt out. This leads to poor satisfaction and potential loss of business. Chapter 5 in Listening Noises explains that fatigue is a physiological and a psychological factor that causes listening barriers. Without listening, effective communication cannot occur. One cause of burnout is staffing shortages. JAMA Network Open conducted a study on the correlation between burnout and decreased patient satisfaction. It's no surprise that there was a connection between the two. Another cause is poor management from companies, and effective leadership and lack of support is not helping. A study by AMA recognizes that the working environment needs improved teamwork and schedule changes. Solutions to burnout include peer support. A peer support group can exchange modes of handling burnout. Other solutions include attitude adjustment. Since burnout is partially mental, having a positive mindset can diminish burnout. Maintaining a healthy lifestyle of clean eating and exercising helps as well. Some people may not be sympathetic because they feel it's not their problem. When we ignore when we ignore our caretakers' well-being, we all pay. Some might argue that they are getting paid a lot of money and to suck it up, but higher wages have to be offered for these jobs to be filled. If lower pay was offered, these jobs will go unfilled. Some say that healthcare workers know what they're signing up for, and no one is ever prepared for the challenges of a job that can contribute to the mental and physical decline. So what can be done? The next time you're at an appointment, ask your healthcare provider how they're doing. Let them know that you understand how busy their workload can get and if they need a few minutes before helping you. If you're a healthcare worker, form an alliance with other coworkers and allow each other more time on breaks and a safe space to vent. This plan works by showing support for the overworked. Have you ever had a busy day and someone simply asking how you were impacted your mood? In addition, offering or allowing extra time can temporarily relieve work stress. Specific plan of actions. Change starts with you. We have discussed the definition of burnout, why it's common, and what can be done from workers and the public. So remember next time to give your healthcare worker a kiss: kindness, imagination, and support. And remember that that doctor that seemed dismissive, they just may be burnt out. Alrighty.